with that, let me go to the pro con, and I want to hear what. You just don't have. It's not necessary to ask a question. Go ahead and state, what your view is. And so I think I'm going to go for a supporter first. And again, we have the lights. Is that set to go? Timer? Is the timer set to go?
What's that?
Is the timer set to go?
I don't know.
Will somebody get a watch? Okay. What's that? Okay. 3 minutes. Are you timing? Okay. Senator Osborne Hill. Senator, why don't you come up front here?
We've got microphones, Congressman, for people to talk to.
Okay. Senator, come on down here. Just give her the microphone. It's fine. Go ahead, Senator.
Hi. Thanks for holding the town hall meeting. My name is Sandra Osborne Hill. I'm from Littleton. I'm a small business owner, and I work with small business owners to help them access health insurance. So I deal with health insurance all day, every day. I have a client, a prospective client, who has about 25 employees and just got a 68% increase on his health insurance plan. So his average employee makes about $35,000 a year, which is about the average wage in this country. What is he supposed to do? Is he supposed to pass that 68% increase on to his employees, who now, to cover their families, it will cost them $1,700 a month? So when you pay $1,700 a month for health care and you make $35,000 a year after taxes, that leaves you about $8,000 a year to feed your kids and to pay your mortgage and to pay for your car, to buy school supplies. The math does not work. And without a public option, he's left with no choice. My question is, we have competition in the marketplace now, supposedly. He's with United Healthcare. I didn't say that, you guys did. He could go to Humana, who's going to give him maybe a 60% increase over what he got last year. Or he can go to Anthem and get maybe a 62% increase over what he had last year. So we theoretically have choice in the marketplace now. We have private insurance companies who will gladly offer him a plan. The problem is he can't afford it and his employees can't afford it. And this is a business owner who is trying to do the right thing. He wants his employees to have health insurance. He wants to take care of his employees, but he is left with no choice.
Thank you. Is there anybody who feels that our health insurance system doesn't need reform? Is there anybody here that believes that it does not need reform? We all agree it needs reform. It's a question of what direction it takes. And we have a high-risk insurance pool in the state of Colorado. I believe is it 150? Where are we at in terms of the average premium?
140% of the standard market rate. We have almost 10,000 people.
So we have a high-risk insurance pool in Colorado that's subsidized, I think, by premium tax and by the unclaimed property program when I was the state treasurer. So we do have that in Colorado, and certainly if an individual has people like that, and you know of an individual like that, they ought to look at that particular plan. I can't address that specific situation, but we know, because I don't necessarily know the facts. It seems that it's not competitive, and we have a high risk pool. We're not here to say that. I'm not saying that the system doesn't need to be reformed. I believe that the system needs reform, and I think that I've stated some reforms that need to be done. Okay, let's go to the next person who's against.
My concern is that the bill is being rushed. I've downloaded the bill, I've tried to read it. It is huge and incomprehensible. And my concern is, who's going to implement this? How large of a government bureaucracy is it going to take to figure out what this bill means and how it works at the local level?
Okay, is it Ginny Aldridge?
Jerry.
Jerry Aldridge, okay.
Well, I guess I have a little bit of a question about her question, because my understanding is there's like 5 bills in Congress right now that are in various committees, and, you know, some in the House, some in the Senate, and that the one in the House still does have the public option, isn't that correct?
Yes.
Well, you have addressed a couple of my concerns. I just think this pre-existing condition situation is ridiculous.
Right.
I heard a man interviewed again today who had, his pre-existing condition was gout. They're charging him $650 a month. His deductible is like $3,500 before it pays anybody. And I do think that's just unacceptable, that no matter who is in charge, that has to go. The other piece that concerns me, though, is I know you're an advocate for the free market. The company that's charging the additional 68% to that small businessman, United Healthcare, their CEO is now making $100,000 an hour. That is unacceptable to me. The salaries of the CEOs of the major companies, like Cigna, Humana, between $20 and $40 million a year. I feel that when Reagan said this should all become for-profit, and I'm old enough to remember when we had non-profit and Blue Cross was cheap, and I was in my 20s and I could buy Blue Cross here, no problem, right? I just think we have to regulate in some way the salary. We have to regulate this insurance industry, because as I see it, health insurance is a part of our commons, like the fire department, the police department. It's not like it isn't like going out and buying a new car. And that I do believe that we now are the only industrialized nation in the world where 1 million people a year are going bankrupt over health issues. That's not happening anywhere else in the world. I think that's unacceptable. And also your point about the insurance pool. My son works for a small business in Tucson. 50 employees, and a lady there died of cancer a few years ago. Well, their premium just went through the roof. And this is a nonprofit. It's a part connected with the national monuments. But I've heard a number of people say we must, you have the same insurance I do. You're a federal employee. My husband's a retired federal employee. I'm a retired teacher. We are in a public option. The VA is a public option, Medicare is a public option, it exists. The overhead is 3 or 4% instead of 30%. And I'm sorry, that was business.